Back.
Thank you for staying tuned. Now let's talk health. Today we're looking at the most highly abused prescription medicines and the legislation around dispensing them. And of course, doing justice to that is Kenneth Etokakpan, a pharmacist with over 7 years experience in clinical and community pharmacy, drug supply, chain management, and digital healthcare. It's such a pleasure to have you in the studio.
Thank you once again. Thank you.
Fantastic. So I know we've touched on this some weeks back, but I feel we have the need to actually expatiate and make people understand why you go to the pharmacy sometimes and you're told you cannot be sold certain medication. Yeah. So let's talk about this, the medication.
Okay. So those classes of medications fall under something called prescription-only medicines, and they are under something we also call controlled drugs. Drugs. And those controlled drugs are not supposed to be sold in the community pharmacy without a valid doctor's prescription. Not just a doctor's prescription, but a valid doctor's prescription.
Let me make you pause there.
Yeah.
You said valid.
Yeah.
Emphasis on the valid.
Valid, yeah.
How can you tell it is valid?
So there are certain things in a prescription that has to be there to make sure it's valid. So the doctor's name has to be there. The date has to be there. The name of the prescribing facility, that is the hospital in which the medicine was prescribed from. Also the dosage of the medicine, the date, and the signature of the prescriber. Those are things that make a prescription valid. Without it, you cannot, it invalidates a prescription.
So there's no such thing as maybe a scribbled medication on paper.
No,
those don't work.
It doesn't work. It doesn't work, and it completely invalidates. And the pharmacist is not even supposed to sell prescription medicines with those kind of prescription because he can go in for it. So there's something called the disposal poisons book in a community pharmacy that helps in which the PCN, that's the Pharmacist Council of Nigeria, helps to regulate the sale of controlled medicines. So without that, pharmacists cannot sell medications, right? And every medication that is sold has to be properly documented. The prescriber's name, the date in which it was dispensed, all that has to be properly documented because every year the PCN, that's the Pharmacist Council of Nigeria, checks it just to make sure that everything is complete and all the drugs are intact. Yeah.
So now going back to where you were before, what you were talking about, so we already know quite well now that there are some medications that you cannot just gain access to.
Right.
So in a situation where you are given a prescription and you lost it, and you happen to be coming from a government hospital, where to get another prescription, it will probably cost you, a lot of stress, let's put it that way.
Yeah.
Is it possible for concession to be given? And if so, how?
So it's possible, especially if the pharmacy in which you're going to has a relationship with the hospital. Right? So they can easily call the hospital to confirm that, oh, did you see this patient? Did you see this?
Government hospital.
Yeah, if the doctor, not the hospital, not the entity, the doctor, so the prescriber. So for example, maybe the patient sees maybe Dr. A, right, and comes out from Dr. A's consulting room and comes to your pharmacy and say, oh, pharmacist, oh, sorry, I misplaced my prescription and everything, but I saw Dr. A. And if you're lucky and the pharmacist has a relationship with Dr. A,
you can call Dr. A
to confirm that, oh, did you see this patient?
But if he doesn't have that kind of relationship or is a different pharmacy, you have to go back to get it.
Yeah, because it's quite important.
So what kind of medication now can pass that check? Which ones can be allowed? Because, abuse of medication is actually prevalent. I remember we also talked about that extensively at some point. So what medication can be used? Because, say, for example, cough syrup. People drink cough syrup. Yeah. So what kind of medication and how can you know exactly how to stick to it?
Okay. So you rightly mentioned cough syrup, especially cough syrups that come with codeine. Right? Those cough syrups are prone to abuse and reliance, right, by people that use it. Also, we also have something called analgesics. like the morphines and the fentanyl and the tramadol.
Which can be fatal
Which can be very fatal and also has tendency to be abused by people that use it. Right? That's why you can't just walk in. That's why even the NDLA had to ban it at some point, and NAFDAC also. So you can't just walk into a pharmacy and get those medicines. You have to have a valid doctor's prescription to be able to access those medicines, right? Those are just some examples. So analgesics, pain relief, tramadol, codeine, fentanyl, morphine, diazepam. Those are some medications that you cannot just access in the pharmacy without a valid doctor.
So now let's talk about the penalties.
Right.
I'm asking because many people don't realize that it's actually a serious thing, and the fact that the Pharmacist Council of Nigeria doesn't joke with issues like this.
Right.
So for a pharmacy that refuses to sell you certain things, can you explain what the penalties are?
So they could close down the pharmacy, right? It's that serious because I think some years back there was an issue where a patient walked in and requested for Rohypnol. Rohypnol is this popularly called date rape drug. Right. So the patient walked in and the pharmacist, I think, couldn't access the prescription, but the patient was begging and begging and begging, and just said, "Okay, take." And that led to the lady was raped and she eventually died. Right. So it was serious. The pharmacist was jailed, and I think he's still in jail at this point. So it's actually that serious, right? They could close out the pharmacy. The pharmacist could
get into serious trouble.
Yes, and go to jail. So it's quite serious. So when a pharmacy asks you to present your valid doctor's prescription, they know what they are doing. They're actually trying to protect your health and actually trying to protect the image of the pharmacy too. Okay,
so we know quite well that a good pharmacy, a reputable pharmacy, is supposed to have a pharmacist in attendance. In a situation where the pharmacist in attendance isn't available, not because it's not been employed, but maybe because it was ill or something, and then the store was still open because apart from the pharmacist, there's also the store attendant. And an incident happened in such a way that the store attendant sold, say, for example, the Rohypnol you mentioned just now. How would such a case be handled?
Here we go now. Here we go now.
It's back to school season and there's something for every student to shop on Jumia. From phone accessories to self-care products and much more, you can get all your school essentials on Jumia, your everyday delivered.
So legally, they are not supposed to even have access to that. But in cases like that where the patient actually presents a prescription, it has to be properly documented, properly underlined, properly documented. So you have to write the name of the patient, write your name, the person that dispensed it, write the date, write the hospital is coming from, the prescriber, all that. So in that situation, the person on duty can actually dispense, but it has to be properly documented. But in an ideal case, they're not supposed to have access. It's only the pharmacist.
And that's why some medication are locked away.
Exactly, in the poisons cupboard. Very true.
All right, so thank you so much for shedding light on this, especially for those who don't understand how some things happen and why pharmacies are so essential. And pharmacists as well. Thank you so much for your time, Kenneth. All right, with that, talking health, we'll talk about good food as well. Healthy eating is part of life, and I know quite well that it's time for us to see what's for breakfast. Mike has been whispering since. I wonder what's happening already.